What is a good doctor? Before we start, I just want to mention to these viewers, because I was one of those guys who wanted to be a robotic oncologist. In the second year of my residency, I was able to come over here to attend the AUA, and the Da Vinci system came out, robotic, surgery system came out. It fascinated me. Why did you choose to infertility and sexual medicine? Why?
Like you, I also trained at an era when the robotics was becoming very hot. I was very lucky. I did my training in Washington, D.C. at George Washington University, where I did a 6-year residency program, which is not common today. Today is usually a 5-year residency program.
6-year residency?
So I did 2 years of general surgery and 4 years in urology. It was a very traditional program.
Wow.
So I had a very good experience in robotic surgery. So I feel very comfortable with robotic surgery at the end of my 6th year. The reason I did a fellowship wasn't to be a better robotic surgeon. I feel like I was very comfortable, but I wasn't very well trained in sexual medicine and microsurgery because so much of the emphasis was on robotic oncology that our training really lacked a lot of the benign disease training. So especially in prosthetic urology and in microsurgery for infertility. So I thought if I want to learn something extra, after 6 years of training, I want to do something new that I didn't know before. I didn't want to just do something I already learned already. So that's why I ended up choosing
But usually, how many years you had to be in training?
20 years in school and another 6 years in residency.
26 years? Don't you think it was enough?
Absolutely. I'm not going to lie. I had what we call training fatigue. So at that time, doing a fellowship was a hard decision. My father at the time had health issues. And my wife and I were really struggling to pursue more training or be done with training, start working and have more personal life to spend time with our family. And unfortunately, my father passed away in my chief year.
Oh, I'm sorry.
In my training. After that, we decided that it's still the right thing to do to pursue a fellowship and complete my professional development.
So where did you go for your fellowship?
We ended up in Houston, Texas.
Oh.
So I was very lucky to be accepted by Dr. Lipschultz, who did a lot of early work in infertility and sexual medicine, and that he took me on as a fellow for 1 year.
Wow. Then you didn't pursue the robotics?
Yeah, so it was very interesting because I thought after fellowship, what am I going to be doing, right? I didn't know was I good enough to do fertility, but I knew that I know how to do robotics. I knew I can do prosthetic urology. So I thought maybe I can help patients by doing robotic surgery and also take care of their problems after robotic surgery. A lot of the patients after robotic surgery have urinary incontinence, they leak urine, or they also have sexual dysfunction. They cannot have erections. But most robotic urologists, as you know, they're cancer doctors.
Yes.
They don't take care of the side effect of cancer treatment. I thought I would be unique in a sense that I can be their cancer doctor and their cancer survivorship doctor. So that's really what I thought I was going to be doing. I was going to get a job, I was going to do robotics, and then I was going to do prosthetics so I can take care of the patient from the beginning of their cancer diagnosis all the way even when they're cancer-free. But then my life changed. So I was very fortunate that at University of California, San Diego, the chairman, Dr. Chris Kane, was friends with some of the doctors that trained me in the East Coast. So he was looking for a men's health, sexual medicine person to join him at this department that he just became the boss, the chair of. And my name came up. So I was introduced, and that's where I got my first job after my training, and that's where I am still today.
So what is the ultimate goal with your practice, Mike?
Yeah, I think for me, the number one priority is to help men age better. in the U.S. and other part of the world, people understand what women's health is. But we now know that as the population gets older, men want to age better too. As a man, I'm not okay with my wife aging better than me. Yeah. So I'm going to live just as long as she is.
Yeah.
So I want to be in good health. And I believe having a men's health center, that's one of our long-term goal, is to take care of men, address the issues related to their aging, and hopefully help them age well, and they can live longer and live well.
What's your second priority?
So my second priority is related mainly to my infertility practice. To me, I don't think I can really relate to parenthood or the stress of infertility before I became a parent. Because your perspective is different. So I think having kids, I really enjoy my family, as you probably can tell. So I see couples that struggles to have babies, and I know what kind of joys they might be able to have having a family. So I really would like to help couples to be able to become parents. So that's my second goal.
What's the third?
So the third goal is related to the academic part of my practice. I believe there's still a lot of advancements that we can make in men's health, in sexual medicine, in fertility care, that working in an academic center, we get the opportunity to get stumped by patients with questions that we don't know how to answer, but we also have the infrastructure, have the support, have the curiosity to ask these questions and try to find answers. So my third goal is really trying to push the field forward by bringing new treatments, new techniques, new medications that could potentially help people.
Great. So as I was able to, invited to the Taiwanese Urology Association for the IPP surgery, everybody was asking me about Dr. Hsieh in UC San Diego. So apparently, many Taiwanese doctors, urologists, are inviting you to the Taiwan to give them a training or to give them a chance to talk about the sexual medicine. What kind of feelings or what kind of goals do you have with the Taiwanese,
Yeah, I think as you from the region, you know that sexual medicine, from a cultural standpoint, is still very tabooed.
Yes.
It's hard for Asian culture to talk about sexual health, even though we all agree it's very important. And that's one of the reasons why I think doctors in Asia doesn't get a very good training in sexual health, and also that they're very eager to learn. So I was very lucky to be invited for a couple of meetings in the region, in Hong Kong, in Beijing, and in Taipei, and I was lucky enough to be visiting professor there. I'd done a few live surgeries there, and make a lot of good friendships there. That I'm embarrassed that they want to do it my way sometimes, but I think that was I think my long-term goal in the region would be to really promote sexual health for men, so that the doctors are better trained, that patients are more comfortable discussing their sexual health problems with their doctors.
Not as a surgeon, let's say as a human being. What do you do in your free time?
I had two lives, one before I had children, one I have after children. So as I mentioned, it changes you a little bit. Before kids, my wife and I really enjoy traveling. I think part of it really come from the fact that I came here at a very early age, and because of my visa issues, it was difficult for me to leave to travel the world. So I had a very strong desire to see the world. So my wife and I, we went to Japan, we went to Europe, we went to Middle East, we went to Lebanon. So we really try to travel a lot, and we also really enjoy good food. So we're a bit of a foodie, so as they call it.
Great to know that. So do you like to cook?
Yes. So in my previous life, before children, I done more cooking than my wife did.
Oh, boy.
I think part of it is maybe growing up in Florida, we were pretty independent. My mom and my uncle, they all work a lot. So oftentimes it's me and my sister's job to prepare dinner. So we got used to cooking. But now that with work and kids and stuff, we don't cook as much as we used to.
Do you like to drive?
Yes, I am a little bit of a car enthusiast.
Oh.
So even though in California traffic's very bad,
Yes.
I still really enjoy driving.
The reason why I asked you about the cooking and the driving is that what I heard from my pathology friend. So one of my friends is urology in the North New York. I was at his weekend house. He invited all his family and gathering and stuff like that. I was invited there. His sister-in-law's husband is a pathologist. He was sitting with us, chilling out, drinking, Diet Coke. And I told him that I love cooking as well. Oh, my urologist friend told me, oh, I love cooking as well. And the driving. Yeah, I like driving. Suddenly, my pathologist, his pathologist, husband-in-law told us that, of course you are. Why? I asked. He told me that that's because you guys are surgeons. Surgeons love to put everything in their own control, just like cooking, just like driving, just like doing surgery. We want to be in the control room, not in the, next to the driver's seat. I hate taking Uber actually, or taking a cab. I even do not like to be in limo. So I like to drive myself. And I didn't know that our personality has really related with being a surgeon. So that's the reason why I asked you whether you like to cooking or whether you like to drive.
Yeah, I think you're right. I think we're definitely a different personality of people as surgeons. And as I work with students and residents, you can tell who has that personality and who doesn't. As having a wife who's a pediatrician, she's a lot more laid back compared to us. She's okay with being on a passenger seat. She is more patient than we are. She's more tolerant of things that when it doesn't go well.